today we're going to discuss something that is common in our society today, and that is heart health. Why we're talking about heart health is because, as we all know, the statistics are not good, meaning the numbers are not good. We have so many people with some sort of heart disease, and so maybe we just want to make sure that people actually know what are the signs and what do they need to do in order to make sure that they improve their heart health. So, heart health, the common diseases that we all know, commonest is hypertension. But there are a number of so many conditions that you could have, including issues to do with how your heart beats, that's your heart rhythm, it's not regular. There are medical terms that you could use, but just know that having a heart rate that is not normal is also heart disease. Your heart could be struggling with the way it pumps blood, and so you retain some fluid, you remain with some fluid in your lungs. That is also heart disease. So what are some of the ways this could present? Something that people take for granted, things like headache. When you have chronic headaches, meaning you keep getting repeated headaches, think of your heart. You might have an issue going on there, your blood pressure might be going up. So actually go and check. Things like dizziness, chest pain. And people who generally do heavy work sometimes take chest pain for granted. But chest pain could actually be a sign that you have an issue with your heart. The other is fatigue. You might have a job that is generally intense, labor intensive, or you've been working long hours, and so you think that the fatigue that you feel or that you experience is normal. This might not be the case, and there might be an issue actually with your heart. Things like breathlessness, especially walking up a hill or even just the regular walk, suddenly you feel like you're losing breath or you're panting as you walk, you could have an issue with your heart. So there are several things, I've just mentioned a few, but that tells you that there are so many symptoms and ways that could show you that your heart is not doing well. So how do you make sure your heart is doing well? There are the simple things like watching what you eat, your diet. Increase the amount of fruit and vegetables that you take. This we have sung over and over again, but we won't stop to repeat it. Increase your fruit and vegetable in your diet. Reduce saturated fats. Saturated fats are things like the oils that you use, the margarine that you spread on your bread. Anything that is an oil, you have to weigh, is it good fat or bad fat? So reduce the amount of fat, reduce the amount of salt. Just put enough salt that you can taste in the food. Avoid adding salt to your food. Increasing your physical activity. Most of the jobs that we do encourage us to sit most of the time, to sit at our desks. And this is not good for our heart. The heart is also a muscle and it needs to exercise just like all the other muscles. So even if you are slim or slender, you have to do some activity, some exercise to get your heart racing so that you can have a healthier heart. Things like sleeping well and getting enough sleep, that is important. So nutrition, exercise, making sure that your diet is right, sleeping, hydrating, all these are very important to our heart health. So let's be conscious that we could be victims of being unwell, of having heart disease, and we need to do something about it. So should you have any of these, please do reach out to a professional to give you a proper check and make sure that your heart is doing well. There are 3 other things that you cannot avoid talking about when it comes to heart health, and these are other prevention modalities. One is weight management. That means you have to strive to be in an optimum weight, and usually this is by ensuring that your ratio of body to height is within the acceptable ranges. The other issue is avoiding use of substances, that is alcohol and smoking, because we know that the tobacco in the cigarettes or whatever you're smoking, whether it's shisha or whether it's vaping, the tobacco or the other toxins, nicotine, and the other harmful substances in alcohol are going to either damage your blood vessels or weaken your heart muscle. So you must control and manage your weight. You must quit smoking if you've been smoking, and you must stop using alcohol if you have been using alcohol. Otherwise, you're going to end up with conditions like hypertension or high blood pressure, or you're going to end up with other heart diseases that cause irregular heart rhythms or trouble with contractility of your heart. So let us maintain our weight, let us cut back on substance use, and let us manage our stress levels to ensure that we have a good heart functionality.